Hi, I'm Heather. All right. Well, when I was age 2, I started getting urinary tract infections, and I had to have a surgery done because my bladder was misformed. And ever since that, I've just been having chronic UTIs, and the doctors put me on a bunch of medications and tried to figure out what was wrong. I had a urologist who studies urology, basically, which is all your bladders, and they said basically, we don't know why you're getting these reoccurring UTIs, and we can't really do much to help you except putting you on long-term medication, which caused yeast infections, so I needed to take some medication for the yeast infections. And I also had
It's been so long you forgot.
Yeah, it has been. I'm so glad I don't suffer from these things anymore. But I had bowel disease, and they were basically like, yeah, we don't know why, what's causing it, and we have all these patients, we don't know why and what's causing it, and we can't do much to help you anymore, except here is a list of foods to avoid, which obviously I didn't follow because I didn't think that it would make much of a difference. I also had chronic fatigue, chronic depression. My face was full of acne, and I had acne on my back and on my chest and on my upper arms, and I still have some scars, but they're slowly healing. And those different acne treatments, I tried all sorts of face creams, which made it worse. I thought that maybe if I scrub my face, it'll get a lot better, but you have to heal through the inside, and that is the best thing I found. So I ended up dropping out of high school because I was so sick and basically bedridden. And I had trouble eating too, which got me down to 90 pounds. So I was a lot skinnier than I am now. But I started eating a fruit-based diet. If you check out Doug's book, the 80-10-10 diet, it basically says that you eat 80% carbs and max 10% fat and 10% protein. And you do so by eating mostly fruit and then a nice salad at the end of the day. And I took health into my own hands because obviously the doctors only know how to prescribe medication. And like someone was telling me earlier, it's not that you're deficient in that medication, so you need to find what you're deficient in and what's causing it and then remove the cause. So my diet would look like maybe I'd have a big half watermelon for breakfast, and then for lunch maybe 10 bananas, and then for dinner I'll have some dates and maybe put those in mixed in with a salad. And yeah, I feel awesome.
How long have you been working the diet?
About 2.5 years now. So, and I'm 135 pounds now, which is amazing because I feel like I've been stable at this weight for about a year now. And before that I gained some weight, so I didn't gain like 40 pounds in 1 year. And what I find is that people who are underweight will get to their healthy weight, and then people who are overweight will lose weight and get to their healthy weight. So your body knows what it's doing when you give it the right fuel, and it heals you. And
you said your weight's stable now.
Yeah, perfectly
stable. Have you had
stable.
any recurrence of the UTIs and other things?
Actually, I've had reoccurrence of the UTIs, and that's when I eat too much salt or too much fat or cooked foods. But I find with the cooked foods, if you eat simple things like potatoes, brown rice, cooked vegetables, it's fine. But once you start getting complicated and refining things, that's when there's a problem. Also, dehydration is a big factor too. But other than that, I have completely cured my UTIs. I have completely cured my irritable bowel syndrome. And my chronic fatigue, depression, acne, I'm a completely different person. I mean, if you ask my counselor who I've had, my therapist, she just say it's like a 360. I'm a completely different person now.
What is her opinion on the diet?
She is so happy for me, and my doctor is too. They did some blood work and it came back perfect. And she says, whatever you're doing it perfectly, because I personally didn't think that diet could make such a big difference. Like, especially a raw fruit diet. She says that she didn't think it would be sustainable, but she kind of went along with it because she wanted to see what would happen. And now she starts recommending it to her her patients.
Fantastic.
Yeah, and my urologist too. He helps his patients by saying, yeah, you know, the salt, the fat, and just eating more simply. He tells them a lot of it is due to dietary factors, which is great.
Thanks for changing the world.
One doctor at a time.
One doctor at a time. I look forward. You also have a YouTube channel, right?
Yes, I do. It's the Raw Buzz.
The Raw Buzz. Cool.
Yeah, I post all sorts of recipes there and how-to videos. You should go check it out. It's really cool.